Welcome to this video on slit lamp examination. Today we're going to show you a very interesting video in which the most obvious finding, which you see if you look very carefully at this area, this is a whitish area which you see over here in the superior limbus. So you need to identify that. The other thing which you're seeing is this pigmented area at the limbus over here. This is just racial pigmentation which you are seeing in this patient. If we go forward with this and let's clear this and draw, and if you look forward going through the slit lamp examination here, these are limbal blood vessels giving a fine network. This is a Hyperoleon. So this is emulsified oil which you're seeing in this area of the superior limbus or superior part of the anterior chamber, because a particle of oil which is present in the eye will rise up, always rise up superiorly. So if the oil will go up, silicone oil will go up, while if there's a droplet of heavy liquid, that will come down. If this is a heavy liquid, this will come down, and silicone oil will always go up. That's why it is always going to block a peripheral iridectomy if it is present superiorly. So you always do a peripheral iridectomy inferiorly when you have a patient who is aphakic or pseudophakic, in which you're putting in oil, so that if the oil comes in and it blocks the pupil, so suppose the patient is aphakic and the oil comes in and it is going to block this area of the pupil like this and causes a pupillary block glaucoma, and then what will happen is some of the oil bubble will actually go into the anterior chamber and rise up like this. In this instance, you see this area of the iris which is present inferiorly, that is actually communicating with the anterior chamber. So if you have a peripheral iridectomy, the fluid will keep flowing in this area. So that is the rationale for doing an inferior iridectomy. Or let's go forward and see this patient had silicone oil when you did an examination of the posterior segment. Patient was phakic, so he has a posterior subcapsular which is present over here, which is pretty common if you are putting silicone oil. So this is a posterior subcapsular opacity which you're seeing in this patient. So you need to identify that hyperoleon, a cataract, and the third thing you're going to look for is, does the patient have any silicone oil? So you'll see that sheen which you get when you see patients with silicone oil. So typically there's the shiny reflex from the surface of the retina. So the patient has got the laser marks over here present inferiorly, and he has area of peripapillary 8. This is a myopic disc with a cup to disc ratio of about 7 or so, and this is the area, and this is the area of peripapillary atrophy. So this is the area so this patient is a high myope. That all this thing is going to tell you that this is a high myope, and this is an area of myopic maculopathy as well. And you're getting that sheen from the surface of the oil in this patient, which is very important to figure out in patients with silicone oil. And here you can see the inferior meniscus as well. If I just go backward slightly and show you over here, the next thing you want to see is that inferior meniscus which you're seeing in this patient. So this is the inferior meniscus. This is where this is the oil where it is finishing off. This is just a reflection of that area. If I draw it again, this is the meniscus of the oil. There's a reflection over here, and there's clear retina over in this area. So you need to identify this. Sometimes there can be an overlap, especially in showing you these videos, but if you know what you're looking for, you'll be easily able to see that. So in order to find silicone oil, look straight, find a sheen on the retina, and then ask the patient to look inferiorly and see that inferior meniscus, and then tell the examiner how much silicone oil fill the patient has. This is an area of cryo or laser marks over here in the retina, and this seems to be a buckle over here which the patient has undergone scleral buckling and vitrectomy, which both are visible And hyperoleon we usually develop when the silicone oil tends to get emulsified, and emulsification usually happens when the oil rubs against these areas of the zonules. So if you have got the lens, if the cornea is over here and this is the posterior segment you've got, if this is the lens and these are the zonules, actually what they say is if there's oil fill over here, this oil is going to rub against these zonules and get emulsified, and you get these small particles in siliconal oil. And these particles tend to go back from this area between the zonules and come forward in the anterior chamber. And actually what you're seeing in this patient over here was a hyperoleon, those particles of silicone oil which have gone forward in this area. So I also showed you slightly higher magnification as well to give you an idea what we are looking for. Thank you very much for watching.